everyone, and welcome to this webinar, Profitable Radiology Practices, 5 Strategies to Drive ROI and Improve Patient Access by CCD Health. My name is Denise from the marketing team at CCD Health. We appreciate you joining us today. First, I want to introduce to you our speakers, Mr. Will Scott, who is the Vice President of Business Development at CCD. Will has over 20 years of experience in sales and management within the medical imaging industry. And as the CCD Vice President of Business Development, he is instrumental in creating revenue growth strategies and establishing strategic partnerships with healthcare and radiology centers. Will, did I get right? Would you tell us a little bit more about you?
Absolutely. Thanks so much, Dennis. The last 20 years in the medical imaging industry have been pretty up and down. I've seen a lot of changes, a lot of complexities within the medical industry, especially as it relates to reimbursements and things of that nature. And also the most important part, which is the patient experience. It's gotten more and more complex over the years as patients have gotten more and more savvy and more educated about what's going on within healthcare and their own healthcare. It's part of our job to help make that transition and that communication between the medical imaging industry and the patient as smooth as possible. That's what we're going to talk about today.
Thank you, Will. Well, our second guest today is Mr. William Harper, CCD Health CFO. Prior to joining CCD, William worked in corporate investment banking at Citibank. He received his undergraduate degree from Concordia University and his MBA from the University of Toronto. William, we can consider you a financial expert. So thank you for being here today. Good morning. And can you tell us a little bit about you and what you do at CCD?
Hey, thanks, Dennis. Good morning. I've been with CCD now for close to 6.5 years, running basically all of our finance department, the functions, while at the same time seeing what Will just mentioned. We've seen a lot of changes in our clients' business models. We've seen a lot of changes also in how our clients are doing business. And what we want to talk to you guys today about is how can we help you make the right decisions and what to keep in mind as you try to make those investment decisions going forward.
Thank you both for being here. And well, without further ado, let's dive into the agenda for today. Today, we will be discussing the importance of investment and payback in radiology practices and understand its complexity. After that, William and Will walk us through the main challenges and blockers preventing radiology practices from seeing their investments return. And then we will delve into the main topic of this webinar, which is the 5 best practices to improve radiology ROI and patient access. Here, our experts will close this chat with their final thoughts and recommendations. And if at some point you have any questions, comments, or suggestions about this webinar's topic or about CCD services, please drop us a message on the chat box and we will reach out to you immediately. William, I think you can take it from here.
Yeah. Thank you, Dennis. So the first thing to think about, and it's very important for us to remember, is the complexity of healthcare demands that a physician and non-physician leaders develop understanding of the business of medicine, not just the medical side of it. Unfortunately, a lot of the times what this means is that we are learning, or better said, practitioners are learning the business side through either word of mouth, mentors, college of hard knocks, as some people say. It's extremely important to understand that there are many drivers that will impact how an imaging unit or a radiology unit is perceived as successful on a financial basis. Radiology is big business. In most hospitals, the departments of radiology, pathology, and surgery are the primary revenue generators for the institution. Of those, radiology is also one of the ones that has the highest investment in fixed assets. About 50% of equipment budgets in healthcare institutions are often dedicated to imaging units. So it's really important for us to understand the way of getting a return for that investment in order to be successful and also for the medical unit itself to continue growing. The expectations is that these units will generate revenue. However, how much revenue can you generate and how can you reduce some of the operating costs in order to compensate for that large capital investment? One thing we've noticed is this principles apply both to profit and for not-for-profit radiology centers, right, Will?
Absolutely, William. Thank you. I agree wholeheartedly. One of the things that we've noticed about outpatient imaging centers is that you could have a CT scanner, MRI scanner, even a plain film unit as well in the same facility, and that will involve millions in cash, borrowed capital. With adequate attention to technology and capital planning, business planning, and finance, growth promotion, and operational efficiency, the risk can be minimized and the return can be optimized. Hence, a strategy is needed to help physician and non-physician managers understand these business decisions and ramifications. There may be a tendency to include a more significant proportion of non-revenue yet socially necessary services to not-for-profit centers, however. Still, as the state and federal funding levels decrease, it has become necessary for the not-for-profit centers to pursue an increasing number of net positive clinical ventures. The distributions of these profits are dramatically different between the two entities. For example, not-for-profit entities usually plot to achieve a zero balance at the end of the year. They will spend the money improving infrastructure, or in many cases, supporting research and teaching missions to provide annual bonuses to its faculty. To reiterate, the goal of nonprofit institutions is to maximize profit for the work they are doing and going to pay for. More research opportunities, more resident and fellowship positions, more equipment, more seed grants, more healthcare to uninsured and needy, and so on. Even though the bottom line profit at the end of the cycle may register as zero. Something to keep in mind for not-for-profit organizations is that even though profit is not the most important or the end game or the end goal, it is important for them to show their investors that they are spending wisely and that they're spending smartly with the funds that are being provided to them. This could affect their opportunity to have more funds in the future. As it relates to for-profit entities, they like to distribute income as they profit, but they may carry over revenue from one year to the next as part of their balance sheet and retained earnings. They may be publicly held companies, and they must demonstrate profit to declare dividends or grow for their shared equity value, i.e. their stockholders. The goal of the profit may be to maximize salaries in some cases, and in others, mainly when publicly traded, to raise the value of the company's stock. So whichever environment you're in, it makes sense to understand how to run a good radiology practice and maximize the revenue obtained from your work. A couple of things that come into play when it comes to maximizing that revenue is your ROI. William, could I lean on you for a couple of points around the ROI?
Yeah, so it's important for us to remember what we're looking at is basically a return on that investment. The investment is primarily, as we've discussed previously, those large capital investments that in equipment purchasing and site development, even in just your overall infrastructure. So it's important for us to remember that we have to find the return net of costs that actually justifies the investments you're making in these large imaging units. So there's a few things that we don't notice that could be blocking an adequate return. We call those not ROI blockers, but just limiting factors. First of all, it's inefficient scheduling systems. At the end of the day, what you're trying to do is getting as many people to use the machines as possible and doing as many tests as possible in order to increase the efficiency and the throughput of the machine. Please remember that these machines, at the end of the day, do cost multi-million dollars. So any minute that they're not being used, the machine's being depreciated. The machine does have also operating costs that are fixed. For example, we don't turn those off between appointments. We don't get rid of the technicians between appointments either. So by having an efficient scheduling system, you're making sure the machine is being able to produce as much as possible in the time frame that we have them running. Missed appointments are another constant challenge for radiology departments. We've established through our time working in the industry that about 7% of some modalities have a missed appointment. Basically, these are patient no-shows, disrupting workflows. They leave staff and the equipment underutilized and could cost imaging centers significant financial losses, not just on the missed revenue, but on the hidden costs that are still being taken into consideration just to have the machine there sitting idle. So it's extremely important for us that we focus on scheduling as a way of optimizing our return. Additionally, by efficiently allocating time slots and imaging patient flows, radiology departments can increase the number of patients they see in a day, which will increase that revenue, while at the same time, reduce hidden costs that we might not be noticing or taking into consideration. There are other strategies to increase the number of patients seen in a day, which we'll delve into later. But along with that, we have issues of idle equipment. We also have check-in and waiting times, which Will can expand a bit more on.
Absolutely. So as part of that, excuse me, the waiting times are very, very important as it relates to radiology centers. Usually it can benefit from the adoption of virtual waiting rooms, contactless check-in, and text-based communications that have gained prominence during the COVID-19 pandemic. These tools are not only address the pressing issue of patient anxiety, but also enhance the safety and efficiency in radiology departments. This helps to create a patient-centric experience with less time spent in waiting rooms, faster exam times, and that ultimately can reduce the time to diagnosis. Also, optimizing the radiology scheduling workflow can better manage the expected growth in volume of requests for imaging procedures and organized appointments, and it also can help reduce the amount of patients' wait time. Investing time in optimizing the scheduling workflow and experience prior to the appointment can create a value model for radiology institutions going forward. Patient access is also a very, very important aspect of this business model. One of the things that we've noticed is that giving the patients the proper access to their healthcare is something that's vital in today's medical imaging world. As we talked about earlier, patients have become more savvy, they become more educated about their healthcare, and they want to be involved in the decision-making and the diagnosis process. The issue of scheduling and patient access in radiology, it involves several scheduling techniques and challenges in collecting data. There's differences in scheduling practices across different healthcare settings. Patient perspectives on acceptable wait times are not always well considered in scheduling decisions. So highlighting the need for improved access and management, scheduling practices in healthcare has become critical. In our U.S. healthcare system, there are 3 commonly used scheduling techniques for both inpatient and outpatient services. These things can help block scheduling as well. Modified block scheduling is another aspect, and then individual scheduling. So those are the 3: block scheduling, modified scheduling, and individual scheduling. These techniques determine how patients are scheduled for appointments based on their specific timeframes and their provider availability. Delays in healthcare are common. I think we all know that by now. But there is a lack of reliable data to determine the prevalence and extent or nature of these delays. Defining when a delay in seeing a preferred healthcare provider is inappropriate can be challenging. Patient views on acceptable wait times are often well captured in existing scheduling assessment tools, and measuring these factors can be costly and imprecise. For specialty care such as radiology, scheduling is influenced by factors like insurance pre-authorization, diagnostic tests performed by third parties, and coordination among multiple specialists. As you can see, it could get really complicated. Having the provider-centric approach in our current healthcare system prioritizes the need and preference of the healthcare providers and organizations over patients. Traditional scheduling may not align with patient perspectives for convenience. Patients sometimes seek care in alternative settings like retail health clinics due to more convenient hours and walk-in options. What we think is part of the issue here is poor research management. It's one of the things that we believe can help as it relates to the patient experience and helping make sure that that gap between what the patient expects and what the providers are providing is closed as much as possible. William, would you mind chiming in a little bit around the resource management?
Yeah, so Will touched upon something very important, and it all comes back to what we mentioned originally. Your resources are right now tied up in either equipment, staff, personnel outside of medical staff, and at the same time in a lot of overhead. Having equipment idle is very poor resource management. Additionally, the use of people outside of their comfort zone, staff outside of their technical skills, is also one of those things we see often. So operational efficiencies and disconnects do weigh heavily on physicians and staff. Most physicians want to focus on giving the best for their patients, but they sometimes find themselves scrambling for information or wasting precious time. We've seen that protocols aren't always very clear prior to and post-care. And what ends up happening is that our staff, our medical staff, technicians, doctors themselves are forced to intervene when at the end of the day, their time is much better suited in providing those medical insights for which they're so strong. We see also a few things that come along when people either show up late, show up early, don't know that they have to do pre-work prior to going for specific imaging scans. And at the same time, what this ends up happening is affecting our bottom line hard. We know the value of digital engagement as well with these patients to educate them, but also to remind them of the appointments. I mentioned no calls and no show previously. That 7% of people who don't show up is a straight cost to your bottom line. What we can do, and what we've seen work as well, is identifying these given certain metrics and being able to touch base with the patients prior to their appointment. This would allow you to either fill up that gap and make sure that your resources are extremely well managed, or at the same time, find a way to either double book in a way that does not affect the regular operations of the center. Now that we have addressed the lesser known ROI blockers, let's speak about those 5 strategies that we believe can unlock return. So the first thing we need to focus on is how do we optimize the center, the equipment, and the staff to increase that capacity. The fundamental challenge facing radiology departments today is how do we increase capacity to meet the demand changes seen by the service, while at the same time being efficient to meet that demand. The first crucial step to do this is how do we increase workforce in the right places. We want technicians, we want doctors, we want support staff to have clear roles and responsibilities to what they're best suited for. For example, we have people that can focus on either pre-authorizations, insurance claims, some follow-up work, or even some of the pre-work triaging before they get to the center. What we don't want to have is doctors and technicians spending some time doing paperwork, doing a lot of the administrative tasks, which may take up a lot of their time. And as we know, that's precious time for us. So what do we do to fix that is implement standardized protocols, have some guidelines for the radiology procedures prior to the appointment and not just at the place of work. We want to make sure that when the patient comes in, there's limited waiting time, they go straight to their appointments, and then most of the follow-up work is done outside the center. This will allow us to not just increase the throughput and capacity, but reduce some of the overhead costs that we see by having large centers that will not actually benefit the company as is. We also want to invest in technology and training to improve the efficiency of the radiology services. We'll speak to this a bit more in the future, but it's very important for us to use equipment to its fullest. We'll now delve into that a bit more, and then can you please let us know what you've seen in radiology centers as they've evolved over the years? What are some of the best practices to manage and optimize that equipment?
Absolutely. There's a few things that we can do to optimize equipment use. A couple of best practices that we've learned over the years, William. One, ideally, radiology teams are making use of all the features available in existing X-ray or radiology equipment. Sometimes, however, departments overlook time-saving features that can help with efficient image capture. For example, there are software features in many of the equipment units today that automatically complete a study upon acceptance of acquired images. This can save a lot of time. Back in my day, just to age myself, when I was a technologist working within the hospital system, we had a lot of manual processes, especially when it came to the completion of the exams, gathering of the images, organizing things, and getting them over to the radiologist for reading. Very time consuming, the post work as it relates to medical imaging. So a lot of the equipment that has been implemented today takes a lot of that away and gives us a lot of our time back as technologists. We have to be very, very keen on how to utilize those features. Another thing that comes into play is the single screen workflows. This gives us fewer screen transitions and customizes our configuration and automated controls. And this can translate into higher throughput and improvements in productivity and efficiency. We like to check in with our radiographers to make sure that they're making the full use of features and that can assist with expediting exams and delivering repeatable results. Best practice number 2, leveraging time-saving features. In addition to equipment control, medical imaging center systems across the country have now come up with cutting-edge features that allow for artificial intelligence and machine learning algorithms. These AI-powered features automate steps in workflow and are often considered time-saving. AI features can also assist with more consistent outcomes, whether related to positioning, technique, collimation. Any of these things can ultimately reduce workflow and boost workflow times. Another step in maximizing return on investment, CareStream's AI-based smart DR workflow, for instance, includes smart positioning, smart technique, and smart collimation. These are all things that, again, during my time as a technologist, we didn't have these AI-powered or machine learning algorithm features within the equipment. Things like positioning, that was manual. Things like smart technique, very manual. You had to understand technique and know those things in your brain on an ongoing basis for what could seem like hundreds of different exams. And smart collimation, understanding how to collimate your field of view down to the specific body part of a particular exam. These are things that are all critical to getting proper exams and making sure that the patient diagnosis can be as accurate as possible as it relates to radiology and medical imaging. So as you can see, equipment plays a pivotal role in enhancing efficiency, but just as much as the patient-centric approach in radiology, this approach aligns with our goal of delivering acceptable healthcare and experiences to our patients. William, would you say that's right?
I totally agree with that. And that takes us to point number 3, which is extremely important as well. We've spoken at length about the optimization of expenses, management, capacity of resources. However, as we mentioned at the beginning, imaging is a significant source of revenue for medical centers. It is one of the largest drivers of income. So in order to improve our ROI, we also have to look at how can we protect our top line and making sure that the patient experience and the patient is a repeat customer. It's important to recognize that many patients have very low switching costs when it comes to choosing an outpatient imaging center. Convenience, location, number of tests, or just the referring physician's recommendation carry significant weight when they choose where to go. So by using a patient-centered approach, we can improve a patient's experience and reduce the likelihood that a patient would switch to another center for a future visit or for a follow-up visit. By reducing the time they wait for their appointments, by reducing the time they wait for the results, will help them have a much greater experience. Eliminating repeat visits for the exact same test is also something we try to avoid. This goes back to what we mentioned previously, protocoling and making sure that the communication channels with the patient are extremely clear and at the same time constant, allows for this to continue going forward. There's a few additional steps that we can take that will help with that. For example, fast, accurate reporting, as we mentioned previously, waiting areas that are organized for children, for inpatients, that also helps us ensure their safety and dignity. Adequate space for social distancing is essential in these days. While we've mentioned this a lot and we'll continue to talk about it, it's clear protocoling and patient education. Patients should be informed about their imaging procedures prior to showing up, what the benefits are, what the risks are, if there are any limitations to the test, and also the delivery times ahead of the visit. By having clear expectations, we reduce the unpredictability that is automatic in our lives, and at the same time, have a baseline expectation which we can only strive to improve. At the same time, providers do benefit from this as well. We have reduced pressure on emergency and primary care departments if we're able to do things efficiently and maintain the patient center in our practice. This also has increased overall capacity. We have reduced administrative burdens to technicians and doctors, as we mentioned previously. Fewer missed appointments, and we will also contribute to better efficiency and sustainability. So now let's transition our discussion to explore another critical aspect, prior authorizations and reimbursements, which are some of the most constantly cited sources of issues for primary care practices. Right, Will?
Absolutely. Prior authorizations and reimbursements are one of the things that we have, especially in the last probably 5 to 7 years, seen as a really big pain point for a lot of our partners out there in the field. Prior authorizations, for instance, have always been a highly manual, highly time-consuming process, prone to a lot of errors. This impacts appointment to exam conversions for imaging centers. What that means is lost revenue. What we want to do is make sure that we are able to implement steps to reduce the money that is being left on the table. We want to improve the fair reimbursement for hard work that's being done in the medical imaging industry. We want to minimize the needless expenses that chip away at profit margin. Unfortunately, the third-party payers have a business strategy as well. They aim to do whatever they can, within guidelines and legal means, obviously, to pay the least amount per study and only if the studies performed are billed and coded appropriately. If they can justify not reimbursing 1 in every 50 studies, for instance, that they previously were paying for whatever reason, they're already generating a 2% improvement in expense management. The delays that payers create in subjecting physicians and repeated submissions of their bills creates the initial denials for various antiquated reasons, and it creates money through the concept of accounts payable delaying strategies. You should be able to use or block these things from happening to you by utilizing strategies that we have come up with over the years to help automate a lot of these processes. One of those being electronic prior authorization that reaches out and gets a lot of those authorizations for you and reduces the amount of errors, reduces the amount of repeat submissions, and helps increase the amount of revenue that you're seeing straight to your bottom line as it relates to prior authorizations. Reimbursements as well. We can help with implementing strategies, best practices that we've noticed over the years in working with different partners across the country in many different regions and many different segments, and dealing with many different payers and how they reimburse. We can help implement best practices as it relates to some of those strategies. And hopefully the goal is to help maximize the amount of revenue that you're bringing back to your bottom line. Now, William, as we approach the culmination of our discussion, let's turn our attention to one final strategy, a comprehensive review of the radiology workflow.
Thanks, Will. And you mentioned that at the end of the day, this is what we do. This is the bulk of the work. It's the workflow within the center. There's a few things that are missing here, and I know you're all aware. We tried to simplify this as much as possible in order to be able to guide the conversation. So don't assume that the other ones aren't as important. However, these are the ones where we can find quick solutions that can help you improve your return. So first of all, between order initiation and the clinical context, there's a lot of work that can be done, as we mentioned previously, with correct protocols. So whoever has to initiate the order from the referring physician into the system or your risk system, how can you actually make sure that everything that is required for the test is already put in place? Is your staff adequately prepared, adequately educated and trained? Or would you outsource that to find someone who actually will do that for you in order for you to focus on the test? Second, it's the clinical context, as we mentioned. How can we transmit that order correctly and make sure that the technicians or the doctors are well aware of what's going on? Scheduling, as we've talked about a lot, is important for us to make sure that the machinery, the center, the patient, and the doctors are all working to the best of their time. We don't want people to have idle time. We don't want to make them wait extra for appointments. We don't want them to cancel their appointments. We want to make sure that everything flows in the correct order. The best way to do this is by trusting professionals and trusting in your existing protocols to make sure that everything that is required is put in place prior to the visit. We've talked a bit about the idea of no-shows. No-shows, as we mentioned, is one of the biggest and one of the most underreported hidden costs in running a center. So by using certain algorithms, no-show predictive models, or machine learning, we're able to identify who might not meet an appointment, and then we can target those people with time ahead of them. So either with a callback, either with automated text messaging, or just a contact via email. This allows that patient to either remember their appointment, rebook it if they know they're not going to make it. But other than that, it allows the center to make sure that their machinery is not sitting idle for someone who didn't show up, that we don't have just people sitting around waiting for anything, while at the same time affecting those that are already in the waiting room, which might see that happen. Numbers 4, 5, 6, and 7 can be summarized in a few words. Primarily, it's how do we make sure that the doctor's point of view, their results, that the patient's information is adequately sent to the patient in a clear, concise manner, in a way that does not affect them and does not affect their ongoing treatment. This fits in a lot with what we mentioned previously of patient care. We want to make sure that our last point of contact with the patient is a pleasant one. Maybe it's not because the diagnostic was pleasant, but at least the manner in which we work with them is. So, for example, timely reception of their results, Maybe it's through an online platform via push email instead of them having to call for them. Billing. Do you want to make sure that your patient is able to bill correctly? Either it's by using some of the tools we'll mention by getting it pre-authorized prior to, or at least helping them through the process of the insurance authorization post. And then finally, it's the post study. Talking to your patients after they've gone through everything, making sure that if there is a repeat, they come back to you, keeping top of mind. Although the workflow is much more elaborate than all that we've mentioned right now, it's important for us to remember that there is different touch points with the patient and different touch points with the medical practitioners that can help this move smoothly, be much more efficient, and at the same time, reduce the ability or reduce the want of a patient of going somewhere else. Want to make sure that we are the top of mind for them and that their experience is pleasant enough to remember that this center, this place, was able to treat me in a dignified manner, and it's where I want to go back if I do have to require additional tests in the future. So, well, I think that we've seen many strategies that could work. I don't know if you want to add some closing thoughts, given your expertise in the field.
Absolutely, thank you, William. Just a quick recap on the content that we've discussed today. In short, radiology practices are often seeking ROI opportunities through investments in additional equipment and also investments in personnel that fit their business model and that are very knowledgeable in their practices and understand how to do their jobs effectively. However, the reality is that there are more avenues to explore when you shift your focus to address both patient concerns and practice management optimization. These are things that we need to keep top of mind as it relates to the medical imaging industry, making sure that we're not only taking care of the practice management and the business side of the optimization of the medical imaging industry and our practices, but also that patient-centric focus is very, very important. What we found is that sometimes we can get so focused on the ROI that we're missing the patient experience. And the patient experience is ultimately what's going to drive our revenue at the end of the day. If patients don't want to come to us, with no patients, there's no prior authorizations, there's no reimbursements, there's no revenue. So we need to kind of shift our focus a little bit, make sure that we're paying attention to the patient, and also have the adequate personnel and the right people in the right seats at the right time to run the business practices efficiently and effectively. So those are things that we try to keep top of mind when dealing with our partners in the field.
Thank you both. That was super insightful, spot on. I think that as we approach the end of the year, many healthcare organizations and radiology organizations are planning their budgets for 2024, seeking for strategies to drive profitability and while enhancing patient access and loyalty, right? So to our audience, we hope these strategies serve as a starting point for that purpose. And please remember, when it comes to healthcare, exceptional patient support is not just a service, but it's a strategic advantage. You can learn more about the optimized scheduling service CCD Health provides to radiology and healthcare centers at ccdcare.com and subscribe to our newsletter. Thank you for joining us today. Have a good day.